So I know we're very much now into winter, 1st of December, with the run into Christmas. But as we kind of come into the next few weeks, and I know it's incredibly busy for pharmacy around this time of year, but why is it so important for the members of our kind of communities to be thinking about pharmacy first? Because they may have heard about it, but could you just unpick some of that for me?
Yeah, sure. And I think the concept of pharmacy first is a great idea, because it helps people remember that actually you don't where's the right place to go in the NHS, and for a lot of conditions pharmacy can be the first place to attend without putting unnecessary pressure on places that are for more complex care. So we have a number of different schemes that people might be familiar with. So we've got the Think Pharmacy First scheme, which essentially can be known as a minor ailments service, and that's a fantastic service we have here across the North East and Cumbria, because it means patients who are eligible for free prescriptions can visit the pharmacy, get the care that they need, along with a consultation with their pharmacist, and have the confidence as well that if their condition that they've presented with needs further escalation, that will be able to happen through the support of the pharmacist and the team. And kind of building on that, we've also got what we call the Pharmacy First scheme, which is a national service as well, and this brings into play the management of some common conditions which might need treatment, such as an antibiotic or an antiviral. So you might be aware that the things that we can treat for this are sinusitis, sore throat, earache, infected insect bite, impetigo, shingles, and uncomplicated urinary tract infections. So this is a great opportunity where patients can come to the pharmacy, have a consultation, knowing that they're being seen at the right place without having to kind of take up an appointment elsewhere in the system.
And I've also heard, I think literally in the last 3 to 4 weeks, that pharmacy can now support with emergency contraception. Can you just give me a little bit more detail on that?
Yeah, that's right. So it's part of the expansion of the pharmacy contraception service, which we've had for a couple of years now, where ladies who require oral contraception can come to the pharmacy for consultation and receive that. And this has now been expanded to include emergency contraception. Okay, so this has now increased the availability of the emergency contraception service, which in the past in places hasn't been fully accessible. We have about 96% of pharmacies across the North East and North Cumbria signed up to deliver this service. So emergency contraception, as people will probably know, is another name for the morning after pill. So if a patient requires the morning after pill, it's absolutely a maximum of 5 days afterwards, and the sooner it's taken, the better. They can have that consultation in the community pharmacy. It's a confidential consultation. Timely access to this service is obviously the key aspect, and this can be found. Pharmacies participating is available on the NHS Emergency Contraception Finder tool.
I mean, it's brilliant, and I think recognising, because Pharmacy First has been going for over a year now, I believe nationally, and one of the things that is new for this winter is the trial of the delivery of nasal flu for 2 to 3 year old children. So that started back in October. But how's that gone from your perspective as a community pharmacist, but also how can you see it having an impact in terms of that level of convenience for school-age parents?
Yeah, so one of the things about children who are 2 and 3 was the uptake hasn't been where we want it to be. So bringing in community pharmacy as an additional provider of this service is great to open up the accessibility. It's great to see how many pharmacies have signed up to deliver the service, and I've delivered the service personally in some of the pharmacies that I work in. And what's certainly key that I pick up from patients and effectively the parents bringing in their patients is how pleased they are to be able to come in to the pharmacy, because they might be juggling various things, children being possibly starting nursery or other siblings, along with work commitments. So coming into the pharmacy at a time that's convenient to them has really been beneficial for them.
Because it's also a walk-in service and available on the national booking system, isn't it?
Yes, it is. Yeah. So good to kind of raise them points around how do you find out about it and which pharmacies are delivering it. And you're right, the national booking system, apart from it being there for flu jabs and COVID jabs, you can book your children's nasal through that service, and that allows you to see which pharmacies are delivering it. But yeah, it's also key that it's there available as a walk-in, and patients have been really pleased with that service offering.
So we know we're now building up into that kind of really busy time of year, particularly for pharmacy, but busy for ourselves. We're out doing the late Christmas shops now, getting ready to meet up with families over Christmas. But what advice would you give parents, grandparents, family members about being winter ready, thinking about kind of the next 4 weeks getting into the new year?
Sure. So I guess the first thing is, are you up to date with your winter vaccinations? We've still got a few patients still yet to come forward for their vaccinations, and that's both for COVID and for their flu jab. So that would be the first thing. Check to see whether you're eligible. Also, a lot of pharmacies offer this as a private service as well, so that's something that could be considered for anyone wanting to look after their health and do that. Secondly, around being prepared. Pharmacies will close normally on the bank holidays. There is a small provision left open for emergencies, but think about, when is your prescription going to be due? Have you ordered it in good time and given the pharmacy team a little bit of extra time to prepare the prescription during these busy periods? And then thinking about, is your medicine cupboard stocked up? Do you have the things for the minor illnesses that might crop up when everybody's very, very busy? So things for coughs and colds, possibly some a bit of diarrhea treatment if you think that's something that you might suffer with. So, and popping into your local community pharmacy, the members of the team will have a good chat with you around what are the best things to have stocked up in your medicine cabinet to prevent any kind of issues of needing to pop out during the busy festive period when some places might be shut.
Absolutely, and actually being able to do that quickly, conveniently, in the next couple of weeks, so you're not having to worry about it as you go into those final few weeks when you've got so much more important things to be thinking about, family and Christmas and indeed other celebrations. I think just the final thing I'd just really be keen for your insights on is that we've heard this year the announcement of the Neighbourhood Health Service, which is bringing care into the community closer, more accessible, meaning that you're not having to be referred on into secondary care or seeking treatment with primary care providers. Where do you see the role of pharmacy really kind of emerging in that kind of concept of delivery?
So I think there's been quite a lot of good groundwork done over recent years, positioning pharmacy to maximise its opportunity. And pharmacy is very much around being accessible and being in the local communities. The pharmacy team, the staff often live within the community and know the community members and what their particular challenges might have. So pharmacy is a great place for encompassing the neighbourhood health idea. And if we think about the different services that pharmacy now offers, these all fit along with receiving care closer to home, and having the right the right touch point. We've got things like the contraception service, we've got vaccination services, and we've also got emerging prescribing services coming through pharmacy. So I think it's a real great opportunity to pharmacy to build in what it can do over the coming years as we support the neighbourhood health programme.
I mean, it's brilliant. Yeah, I'm looking forward to seeing how that lands, as I'm sure you are, over the next year. No, brilliant, Pete. Well, thank you so much for your time today. I know you'll be winter ready if anyone is. So thank you very much for your time, and I'll see you soon.
Yeah, cheers. Thanks, Alex.